right, so we touched on tourniquets. Let's talk about our junctional bleeds now, okay? We know that tourniquets are what we're going to use on an extremity. They're quick, they're fast, they're easy, they're hands-free. So tourniquets are a great choice to deal with extremity bleeds. And I think that should be your go-to if you can use them. However, sometimes we run into those bleeds that we can't use a tourniquet on. They're in those spaces that I touched on. The scalp, the neck, the armpit, the groin, the buttocks, and the perineum. Now, just kind of as a visual, when we place a tourniquet, say our injury is right here. When we use a tourniquet, this is where that indirect pressure comes in. We place that tourniquet between the injury and the heart, and we squish the vessels against the bone. That's indirect pressure. If we're going to pack this wound, now I know my location isn't great, we're going to put material into the cavity that's going to do the same thing. We're just going to put pressure from the outside, which is going to create pressure from the inside. Okay, so we're going to actually fill this space so that it compresses the vessel. Now we do need some material to push against. If we don't have material to push against, we need to create it by putting material in through both sides. Okay, so if we have a through and through injury, we can start with material here, and we can finish with material here. But for the most part, we're going to see kind of 3 different ways to apply the gauze. Now, we've got all kinds of gauze. You folks are probably getting things from all over the world. It's very important that you simply just look at your manufacturer's recommendations, okay? Celox Rapid only needs to be held for a minute. Something like Chitosan needs to be held for 3 minutes. Now, as a broad statement, and in my experience, you're going to want to hold everything for 3 to 5 minutes. Okay, that just seems to be the sweet spot for wound packing. Now, some people might disagree with me, but in my experience, 3 to 5 minutes of pressure after we've packed is what we're going to need to do. We can also pack with just regular gauze. There's no chemical in here that's going to help promote clotting. And you just have to keep in mind that this doesn't build blood clots. It supports the body by creating a gel that's going to help to block that bleed at the vessel. Now, we don't need to dive too deep into how these things work. We just need to dive into how we use them. So I've got a couple of injuries here. You can see that this one is more of just a single finger penetrating trauma, where this is kind of a slashing, more of a linear wound. And we can pack those. Pretty much the concept remains the same. Okay, so we can pack directly, we can pack in a linear fashion, back and forth, or if the wound is big enough, we can just take gobs of this stuff and place it in the wound as well. But let's just demonstrate on kind of our most common injury. So I'm just going to grab a bit of blood here. The first thing we need to do with our junctional bleeds is, again, we need to identify, is it life-threatening? How much blood do I see? Is it enough that I need to treat it right now? Can I treat it with a tourniquet, or do I need to apply direct pressure for a junctional bleed? So the first thing we're going to do is we're actually going to put our fingers into the injury. So this is called digital pressure. And what I'm going to do is I'm going to feel around and try to compress the vessel against something. I can't describe to you what it feels like to, take a vessel, put pressure on it, and have it stop bleeding. What I can tell you is that once you've got it, blood will stop pooling out of the injury. Think of it like a witch's cauldron. You see it in the cartoons where everything's bubbling out, bubbling out. I put my fingers in there. I make sure I reach towards the heart, because it doesn't do me any good to reach towards the away from the heart. And I find something to push it against. Once that bleeding is stopped, we know that we're in a good position to start packing. So now, our emergency is not solved, but it's kind of over because the patient's bleeding is stopped. The next thing I need to do is prep my packing. Now, I'm in a nice clean classroom with a nice blue cloth with a small ham-like mannequin. You guys are going to be out in the dirt, out in the field, out in the mud. This might be a 2-person operation, okay? Because it's important that we don't rip this out of the package, start dragging it through the mud and stick it into our friend's body. So if we have 2 sets of hands, you can have one guy feeding, one guy packing. Just take care not to get this gauze dirty. Once I've decided I'm gonna pack, this wound is that straight in and out. I'm gonna do just a little bit of exploring. So I'm gonna put my fingers in there because it's important I fill the whole cavity. When I get ready to pack, what I wanna do ideally is have material go in. We're gonna start that, so I'm gonna put material in. I'm gonna maintain pressure. I'm gonna gather more material, and I'm gonna switch. Now, ideally, we wanna be doing this simultaneously. However, I'll tell you realistically is it doesn't always work like that. If it's a really small wound, you can only get one finger in, you're gonna have to take your finger out. But if we can, we wanna have direct pressure on the injury while we add more gauze. So we don't wanna be aggressive, but we wanna be assertive. And we wanna make sure that we find all the little nooks and crannies of this injury, because when we fill the space, that's what's putting direct pressure on the wound. Okay, I think I filled that up pretty good. If we have a whole bunch of residual, we can simply place it on top. Next thing we're gonna do is full body weight pressure on top of the injury. Okay, like I said, depending on what brand you're using, the manufacturer will have different recommendations. I just packed with normal cotton compressed gauze. With this, you're gonna need at least 5 to 10 minutes. Now, sitting here holding this for 3 to 5 minutes feels like an eternity, but it's important. Resist the urge to stop putting pressure on this. Now, let's fast track time a little bit. Let's say that 3 to 5 minutes have passed. I'm gonna remove my hands and I'm gonna look at my gauze, okay? I put this lump on here for extra pressure, but if I just peek at this gauze right here, I can see that it's still nice and clear. That means that our packing is probably effective. What we don't wanna see is a bright pink kind of blood wicked all the way up the bandage, because that means our packing wasn't effective, okay? So let's say we did see that. We've packed, we held our pressure for the recommended amount of time. We take this off and we see that we have blood wicking all the way up the bandage. Our treatment then is we're gonna start all over again, all right? All of this needs to come out and we're gonna start over. Fingers go back into the wound. We explore, we try to stop the witch's cauldron from bubbling over. We get our fingers in there. Nice, clean material. And we start again. Now, let's talk about your slashing wound. So let's pack one of these. We notice that we have a wound. It's a junctional wound, it's a deadly bleed. We're gonna put our fingers in there. We're gonna reach towards the heart. We're gonna try to push it up against something solid and we're gonna try to get the bubbling to stop. All right, deep breath. We're gonna start packing assertively. Now, with an injury like this, you can see that we may have to go in a linear fashion. It's not that nice, smooth finger over the top. See, we're trying to maintain pressure as best we can. Once we think we filled the cavity, back to that 3 to 5 minutes. Now, you can see when I'm doing this, I'm trying to do it by myself. Ideally, I'd have some help, but it's not as pretty as you think. It's difficult to wrap it around your fingers. It's difficult to smoothly place it in there, but what we have to do is be extra assertive, get the material in the space, and get pressure as quick as possible. Okay, so with Celox Rapid, we can get away with 1 minute of pressure. That's based on the manufacturer's recommendation. So I'm gonna take a peek. My gauze is nice and clean, so now we need to secure it. I find that the best way to secure this gauze is sometimes with a bandage it's difficult. You wrap it around someone's leg or arm and the bandage is falling all over the place. If we use a chest seal, there's a couple of bonuses. All that pressure is being put on from the inside out with the packing. This is just going to secure that in place. We have a nice clear window to our injury, and that's not going anywhere. A lot of times when we put bandages on, they can end up, rolling up or falling off. This chest seal makes sure that that packing material stays in place. Awesome. That's it, Mike.